Hello, in the next few moments I want to discuss with you a new innovation that will help anyone considering a tummy tuck to decrease their concerns about this procedure, primarily that of the pain that is associated with a tummy tuck. I think there are two procedures that are certainly associated with a significant amount of pain. One is a breast augmentation, and the second is an abdominoplasty or tummy tuck. The reason why pain is associated with both of these procedures is that in both of these we are stretching or pulling the muscle of each of those areas. In the breast augmentation, we're stretching the chest muscle, and in the tummy tuck, we're pulling or repairing the muscles of the stomach. Now, in pregnancy, what happens is that the muscles of the stomach, of which there are two, separate from the midline. These muscles, called the rectus muscles, are normally in the midline, but during pregnancy, they separate for enlargement of the uterus. As they separate, the result is a bulging or protuberant appearance of the stomach. And certainly, we all know that the appearance of a pregnant woman. However, after pregnancy, these muscles still remain separated from the midline. Now, you can strengthen both of these muscles by exercise and doing crunches and various abdominal exercises, but really the only thing that you can do is to tighten the muscles vertically. You cannot bring these muscles together. So, in a tummy tuck, what we do is that we actually suture these two muscles together. And we suture these muscles from the upper portion of your abdomen, just below your rib cage, down to the pubic area. And that is what is painful. Now, for years, what we did was that we gave people and women having this procedure done narcotic type pain medication, oral pain medication. And in addition to that, we also gave muscle relaxants. And both of those types of medications helped dramatically to relieve the pain associated with the tummy tuck. However, each of those types of medications has some drawbacks. Now, the major drawback of the narcotic medication is that if you take enough of that medication, then you tend to decrease your breathing. Now, we want you to breathe well after a tummy tuck surgery, because if you don't, you can develop lung problems. For example, pneumonia and other types of problems associated with your lungs and decreased breathing. Another problem with the pain medication is that the pain medication actually does not take away the pain associated with the pulling of the muscle together. It takes away your perception of that pain. So, over the past 4 or 5 years, what I have done at the Aesthetic Surgery Center is that we have inserted a pain pump. And a pain pump is a pump that delivers a specified amount of local, long-acting anesthetic called bupivacaine. It's a long word, but it's a long-acting local anesthetic. And we place catheters underneath the muscle repair, and it releases a local anesthetic to this area of the muscle. Now, that has the advantage in that it is not a narcotic. It decreases the actual pain that is associated with the muscle repair. Now, a little problem with the pain pump has been that we put little fine tubes that come out through the pubic area that is then attached to a small, quote, fanny pack. And it's difficult carrying this pack around is uncomfortable, and occasionally these catheters can be pulled out. Now, recently we have quite honestly, an extraordinary new innovation that has occurred with the release of this local long-acting anesthetic. And that is, a company has developed a product called Exparel. Now, Exparel is microscopic spheres of lipid, which are actually fat, lipid is fat, surrounding local long-acting anesthetic. So these are little, if you can think of it as little packets, they're microscopic, microns in size, that have lipid, which is this fat, around the local anesthetic in the green, which is bupivacaine, surrounding multiple layers of this. And these spheres are in a liquid solution that are then injected into the muscle that is repaired. The spheres with the lipid then break down over a period of time. This breakdown of these spheres occurs over approximately 3 days, and there's a gradual, constant release of local anesthetic to the muscle. And as you can see, as the spheres break down, the local long-acting bupivacaine is then released into the muscle. The advantage of this is that then we now can eliminate the pain pump and the fanny pack and the catheters associated with that. We also find that it increases your ability to move around, and the effect of the anesthetic actually lasts about 3 days. Most women having this injection find that they have only a moderate amount of pain. I'm not going to tell you it takes away all your pain, but it certainly has resulted in a marked decrease in that problem that is often associated with an abdominoplasty. So, if you have any questions, I'd like you to come in or call about this new, very innovative procedure that we can do now that will help with your concerns about the major problem that has been associated with a tummy tuck, and that is pain. Thank you very much.